Standard Occlusion Theory for TMD. I am Sotokawa, a dentist practicing in Morioka City, Japan. This theme covers the occlusion theory essential for treating temporomandibular joint disorders, organized into the following 24 topics. This time, I will explain the 22th topic. Ideal occlusion. 22. Ideal occlusion. Contents. 1. What is ideal occlusion? 2. History. 3. Late 19th century to early 20th century. 4. Balanced occlusion. 5. Late 20th century. 6. Mutually protected occlusion and organic occlusion. 7. Group function occlusion. 8. Guichet's criteria for proper occlusion. 9. Dawson's 5 elements for occlusal stability. Summary. 1. What is ideal occlusion? Ideal occlusion refers to the bite alignment considered most appropriate for humans. Ideal occlusion has been debated for over 100 years. Examples of ideal occlusion include balanced occlusion, mutually protected occlusion, organic occlusion, and group function occlusion. 2. History. The history of ideal occlusion is explained in detail over 4 pages in Dr. Sumiya Hobo's Encyclopedia of Occlusion. The history of ideal occlusion in dentate jaws can be broadly divided into 3 major eras: the late 19th to early 20th century, the late 20th century, and the present day. 3. Late 19th century to early 20th century. In the late 19th century, balanced occlusion was conceived as the occlusal relationship to be provided by complete dentures, based on Bonwill's triangle, Spee's curvature, and Monson's spherical theory. Balanced occlusion was widely accepted as the ideal prosthetic occlusion for both edentulous and dentate arches. 4. Balanced occlusion. Balanced occlusion, also known as full balanced occlusion or bilateral equilibrium occlusion, is a type of occlusion where all teeth make simultaneous contact throughout the entire process of cusp engagement and mandibular movement. Initially, balanced occlusion was established as the occlusion for complete dentures. Later, it also became a treatment goal for dentate arches. However, by the 1950s, the failure of the majority of cases treated with balanced occlusion led to doubts about its suitability as the ideal occlusion for dentate arches. Currently, balanced occlusion is not set for dentate arches and is reserved as the occlusion for complete dentures. 5. Late 20th century. Around 1950, Stallard and Stewart questioned whether balanced occlusion was appropriate as an ideal occlusion after most cases failed when they applied it during oral rehabilitation for edentulous patients. Subsequently, upon meticulously examining the oral cavities of healthy elderly individuals, they discovered that during eccentric movements, the molar dentition did not make contact, and in the occlusal contact position, the anterior teeth did not contact. Based on this finding, the mutual protected occlusion was established. Various refinements were made to this mutual protected occlusion, leading to the establishment of the organic occlusion. 6. Mutually protected occlusion and organic occlusion. In 1949, Stallard established the concept of mutually protected occlusion. Mutually protected occlusion is a bite pattern where the centric relation and occlusal contact points coincide, allowing the molars to protect the anterior teeth. During anterior movement, the incisors protect the canines and molars, and during lateral movement, The canines protect the incisors and molars. Nasology introduced various refinements to this mutual protected occlusion, establishing organic occlusion. In organic occlusion, the posterior dentition interlocks in a cusp and fossa relationship on a one-to-one basis. Functional cusps contact the opposing fossa at 3 points, three-point contact, while the anterior teeth maintain a separation of approximately 25 microns. When anterior movement begins, the maxillary incisors guide the incisal edge of the mandibular incisors, causing the molars to separate. When lateral movement begins, the lingual surface of the working side maxillary canine guides the distal incisal edge of the mandibular canine and the mesial slope of the first premolar buccal cusp. No other teeth make contact whatsoever. For this reason, it is also called the molar separation occlusion. Mutually protected occlusion is considered the ideal occlusion for natural teeth, while organic occlusion is regarded as a sophisticated prosthodontic ideal occlusion created through the application of orthodontic techniques. 7. Group function occlusion. In 1961, Schuyler questioned the practice of having only the canines bear the occlusal force during lateral movement. He proposed group function occlusion, where during lateral movement, the buccal cusps of all teeth on the working side guide the separation of all teeth on the balancing side. Group function occlusion disengages all teeth on the balancing side using the buccal cusps of all teeth on the working side as guides during lateral movement. Consequently, lateral occlusal pressure is distributed across all teeth from the central incisors to the last molars. This occlusal pattern incorporates a vertical play between the long centric position, the position of centric relation, and the cusp-to-cusp contact position, without any change in the vertical dimension of occlusion. Group function occlusion is currently considered the most practical prosthodontic ideal occlusion. It can be established through occlusal adjustment without causing the problems associated with balanced occlusion, and it is not as difficult to achieve on a dentate jaw as mutual protected occlusion or organic occlusion. Furthermore, this occlusal pattern is supported by many scholars because it is found in the majority of natural dentitions. 8. Guichet's criteria for proper occlusion. Guichet stated that there is no single proper occlusal pattern common to all patients, and argued that the most appropriate occlusal pattern for each individual patient should be selected by evaluating the quality of treatment based on the following criteria for proper occlusion. A. Incorporating elements that reduce vertical stress into the occlusion. B. Maintaining occlusal contact when the mandibular condyle is in centric relation. C. Allowing horizontal mandibular movement until the teeth most suitable for receiving horizontal loads from centric relation become functional. 9. Dawson's 5 elements for occlusal stability. Ideal occlusion may be set on an occlusal splint. However, ideal occlusion is rarely adopted as a treatment plan for patients today. Instead, it is used as an indicator for the patient's occlusal analysis and diagnosis. Regarding occlusal patterns set for dental treatment, it is considered that instead of ideal occlusion, the most appropriate occlusion without malocclusion for each individual patient should be selected. Guichet and Dawson have outlined patterns or requirements for setting treatment plans. Dawson presents 5 requirements for occlusal stability. A. When the mandible is in centric relation, there must be stable occlusal contacts that maintain jaw position for all teeth. B. Anterior guidance must harmonize with functional movement. C. During mandibular anterior gliding movement, all molar regions must disengage. D. During mandibular lateral movement, all molar regions on the balanced side must disengage. E. During mandibular lateral gliding movement or at the limit of mandibular condylar movement, there must be no cusp interference on the working side molar regions. Summary. In the past, ideal occlusion was adopted as the occlusal pattern to be provided to patients. However, it is now increasingly used as a diagnostic indicator in occlusal analysis. Furthermore, the occlusion provided to patients seems to be shifting towards a normal occlusion with a wider, more even bite, rather than ideal occlusion. For these reasons, ideal occlusion is being provided to patients in clinical practice less frequently. Nevertheless, mastering the theory of ideal occlusion remains essential. By understanding ideal occlusion, dentists can dramatically enhance their diagnostic capabilities in occlusal analysis. Standard occlusion theory for TMD. 22. Ideal occlusion is now complete. If you enjoyed this topic, please click the like button. If you have any questions or concerns, please write them in the public comment section below. The next topic is the 23. Case report of TMD.